Hello, I'm Dr. Shane Hand from the Amarillo Family Wellness Group, and today I want to share with you some low back pain tips. We've been in practice for a long time, and we see these things routinely in our office, and we've helped a lot of people with these little tips I'm going to show you today. Low back pain is the #1 leading cause of disability in the United States. The research shows that 80% of people at some point in their life will have a severe case of low back pain, and it's actually the 3rd leading reason for doctor's visits in the U.S. behind skin disorders and arthritis. The good news is it's typically non-organic, which means it's not infection related or cancer related. It's typically mechanical, which means that the low back pain is alignment related. And so what we find in a lot of people is that their hamstrings are tight. You know, I've never found anyone who has a tight low back and loose hamstrings at the same time. And so what we see is one hamstring's typically tighter than the other, and the result is a pelvis that's rotated, and then the spine turns. And so we see that time after time after time. And so what I want to do today is show you 3 of the key muscles that we have people stretch and do a simple exercise with a tennis ball that makes a huge difference. And so the first one is for the hamstring. And so Hayden, I want you to put this tennis ball under your left hamstring here. And what we're going to do here is find the center of the hamstring where the tender spot is. You're going to put both hands on top of it, press down, lean over it a little bit, medium pressure, and then kick your leg back and forth. We're going to do 10 to 15 strokes. The fascia is tight. A square inch of fascia is 2,000 pounds strong. It has a tensile strength of over 2,000 pounds. And so we can't get rid of these, what most people call knots in their muscle or trigger points, in a second. And so we do 10 to 15 strokes on it. We're going to do both sides. And just be patient with it. It takes sometimes weeks to get the trigger point to turn loose. And so that's one thing. Can you feel it, Hayden?
Yes.
Okay, so along with that tennis ball, we're actually going to stretch the hamstring. So turn this way, Hayden. We're going to stretch her hamstring. Keep your knee straight, pull your toe back. If you can't reach your toe, then reach as far down as you can. We're going to do 10 to 15 seconds for the hamstring. So the #1 muscle we're after here is the hamstring. Okay, Hayden, kick back around this way. The second muscle we're going to check is the glute and the piriformis muscle. And so what I'd like you to do, Hayden, is cross your left leg over, and you're going to grab your toe with your right hand. You're going to pull this knee towards this shoulder and turn your shoulder towards it. She's pretty flexible. Can you feel that in your hip? Mm-hmm. You should feel that stretch along the glute, the piriformis especially. One of the key tips to this one is make sure you pull the foot. Now, a lot of people, when I check them on this, push down on your knee, Hayden. I find them doing this. That's not wrong. That's actually stretching the TFL on the front of the leg. But the key to this one is to pull that thing back. Yes. Now, I want you to turn, and I want you to, let's go this way. Lay on this shoulder. Yes, ma'am. Yep, actually lay on your right shoulder. The way we work on that knot is we take the tennis ball, and you're going to put it right about where the pocket is. That's about where that knot's going to be. And on the floor, you're going to lay on that tennis ball. Now, you're not going to lay straight up and down. You're actually going to turn at a 45-degree angle. And can you feel it there, Hayden?
Yes.
And so you get it right on the knot. You may have to roll it around a minute to get it right on the spot. And then you're going to bend your bottom leg, Hayden, and bend your knee up and down. Again, 10 or 15 times. You'll know you're on it because it hurts. And so if you find that knot is too tender to lay on the tennis ball, okay, Hayden, you can set up for me. You could actually get against the wall, and you could put the tennis ball on the hip against the wall and lean against the wall and then lift that leg up and down. That's another way to do it. All right, Hayden, kick back around this way. Now stand up for me. The 3rd muscle that we're going to check here and face this way, we're going to check the hip flexor. And so the hip flexors are tight in the front. Now, you know your hip flexor's tight when you sit down for a long time and you go to stand up and you can't hardly stand up. In other words, you stand up and you're like, oh my gosh, I don't know if I can. You feel like you're pretty old. And then once you get up and get going, then it's okay. That's a huge clue that your hip flexors are tight. And so this one in yoga would be called the warrior pose. And so, hey, put your left foot back and then your right leg forward. And so here's one way to do that stretch. She's stretching her left hip flexor. In yoga, they take both hands and they raise them up. For if you're feeling kind of weak or out of balance, hold on to something with one hand while you lean that leg back, and you should feel that on that left side. Can you feel it there, Hayden? Okay, do the other side. Let's check the other side. Yes, ma'am. Okay, and then raise that arm back up. That's one way to do it. Okay, and then for the tennis ball and the hip flexor, I'd like you to lay on your tummy next, Hayden. Get on the floor and take your tennis ball, and right where the hip bone is, you'll feel the front side of the hip bone here. You're not going to be on the hip bone, but just inside the hip bone. Take that tennis ball and put it right inside the hip bone, and then you're going to push down on it with your hip. Can you feel it there, Hayden? So just pressure on that tight spot in the hip flexor actually will loosen it. Another thing you can do is take yourself and kind of roll up and down and back and forth. And so that's the way to do it. Okay, Hayden, you can set up. We find that these 3 stretches, when we have our patients do these, they get excellent results. And so if you have any kind of back pain, or you know someone who's suffering with back pain, tell them to come to our office. Our website is amarillawellness.com, and we're always running new patient specials. So I hope this helps a lot. Have a good day.